From Lexington Medical Center is OBGYN Dr. Alvin Strasburger. Thank you so much for your time.
Yeah, thanks for having me.
Well, recently on Friends at 5, we had talked about women who have died, unfortunately, either during or after childbirth. So I'm curious, what is your message to women then who might have some hesitation about giving birth or even becoming pregnant?
Sure, yeah. And, you know, over the past number of years, there has been an increase in maternal mortality and morbidity. And I think the biggest thing to know is that there are ways to help prevent these issues, whether it be making sure that you're getting early prenatal care, making sure that you're optimizing your health prior to pregnancy, eating well and exercising during pregnancy, and just making sure that you're keeping a close check with your OBGYN or midwife to make sure that everything that can be done to make you healthy during pregnancy and afterwards is.
Understood. And also, once women give birth, and I can talk from experience, I have a 2-year-old basically. Once women give birth, the concerns do not stop there. I had a friend who went home and unfortunately she had severe headaches, nausea, she was taking her blood pressure, and then she said something's not right. So she was rushed back to the hospital. So do we continue to pay attention after the fact? Yeah,
and there's actually a big focus on postpartum care over the entire nation. South Carolina's recently increased the postpartum care in Medicaid to a full year. We actually see an increase in blood pressure over the first few days postpartum, particularly in women with preeclampsia. And trust your gut. If there's something that feels wrong, call or come in.
Well, that being said, I'm curious then, what are the other red flags that if I'm at home, I gave birth, what should I be paying attention to? Given that women are doing everything to bring that baby home, so it's hard to think, hey, I need to take care of myself.
Yeah. Get some sleep if you can. It's hard.
That's a trigger.
So the big things, particularly for preeclampsia, like your friend, would be monitor for headaches, elevated blood pressure, vision changes, pain in your belly, worsening bleeding, worsening swelling, and again, stay in contact.
Okay. I'm also curious, you know, some folks have a hard time speaking up for themselves, being an advocate for themselves when they're in the hospital. So what can I do to plan ahead for that? I know a birth plan is always a great idea.
Absolutely. Yeah. Spend some time doing some research, talking to your prenatal provider about the options that are available where you're planning on giving birth. Speak to doula if you're interested. Speak to your friends and family about their experiences. Be as educated as you can about what you want, and try and just spend some time during your prenatal appointments talking about what you're interested in. Make sure that your family's there in the delivery room to help advocate for you as well, because you may be tired. It's a tough time, right?
Absolutely. So many things are going through your mind. Real quick, what's your final message that you want folks who are watching this interview to take home?
I think the biggest thing is try and optimize your health before pregnancy as well as you can. Exercise, diet, take a prenatal vitamin, and you're going to do great.
Thank you so much for your insight. It is so appreciated. I know women are watching this thinking, okay, I know what I need to do now. Thank you.
I hope so. Thank you.